Hello, my name is Mawj, and we will be talking about X-ray imaging, current status, and future prospects with my colleagues Ornela and Mena. X-rays are a framework of electromagnetic radiation, meaning they have high energies that enables them to pass through many objects, including the human body. Since Röntgen's discovery that 2D X-rays can identify bone structures, X-rays became highly used in medical imaging. Currently, there are many different medical uses for X-rays, and the most prominent ones are radiographs, computed tomography, angiography, and fluoroscopy. X-rays work by passing a beam of electromagnetic waves through the body. Each area of the body absorbs X-rays differently depending on the density of the tissue. Soft tissue, such as skin organs, cannot absorb the high-energy rays, and the beam passes through them. Dense materials inside our bodies like bones absorb the radiation, and thus the machine is able to create image with various shades of gray, depending on the density of the tissue. There are other variants applied to X-rays that enable the imaging of less dense body tissues, and now my colleague Ornela will go through them in the next slide.
Fluoroscopy is the use of phosphors to glow the internal structures when they are exposed to X-ray, which give a better view of tissues. Angiography is another variant, which is the injection of a contrast agent to view the structures of soft tissues, such as brain, blood vessels, and cardiovascular malformation. Mammography is a special type of X-rays used to diagnose breast cancer. However, computed tomography is a 3D imaging technique used to view soft tissues.
The current status of X-rays can be credited back to the contribution of many scientists and engineers who have devised a host of new uses for this uniquely penetrating form of light. Figure 1 shows statistics for the use of different imaging modalities. In the year of 2000 and 2001, it is evident that general radiography was the most common modality referred to by JPs in comparison to ultrasound, computed tomography, nuclear medicine, and magnetic resonance. This could be due to the lower cost of X-rays in comparison to the other imaging modalities, as evidenced in the results obtained in Figure 2, where X-rays had the lowest total cost per examination. In the most recent years, in 2011 and 2012, the trend shows how X-rays referrals started decreasing and CT had a slight increase. This could be explained because CT shows a greater contrast in regard to soft tissues imaging. Despite the decrease in the referrals for X-rays, this 2D modality is still in wide use due to the low cost, high resolution, and depending on application, lower radiation dosages in comparison to other modalities. Now I would like to pass it to my colleague Mena to talk about the importance of X-rays.
Since the discovery of X-ray technology, it became the key component in identification, diagnosis, and treatment of many types of medical situations. Before this invention, diseases were diagnosed by physical examination, doctors' observations, or experiences on dissected cadavers, which in some cases led to the wrong diagnosis and treatment. However, nowadays, with the availability of X-ray imaging techniques, broken bones, tumors, and other internal diseases are diagnosed accurately. This had a great impact on saving large numbers of human lives. For instance, breast cancer was the most diagnosed invasive cancer in Australian females, accounting for 28% of all cancers. Without X-ray and its vital role in forming the basis of mammography screening, we wouldn't have high-resolution images of the breasts. Therefore, no diagnosis would be detected, and the disease will remain unknown and untreated, leading to death in most of the cases. The same applies with fluoroscopy, which is a developed form of X-rays that enables us to detect complex diseases including cancer in the gastrointestinal tract, which is the most sensitive system of the body, that requires safety and accuracy within diagnosis. Although this method is still used today, We require faster and less invasive processes. This explains the extensive use of X-ray CT scan in the diagnosis procedures of soft internal tissues and organs performed in hospitals, which provides us with an identification of processes and structures, their size, shape, and textures, as well as detecting abnormality, which cannot be achieved by plain X-rays only. And this contributes to the treatment and operation success by providing rapid results with images along with a clear and accurate information.
Ready?
Especially in medicinal field, they are non-invasive techniques that provide a clear and precise diagnostic for internal body structures. They are highly useful in emergencies as the image is obtained within few hours with less harm and pain to the patient. Financially, they are provided with low cost compared to other imaging modalities. However, people nowadays are continuously arguing that X-rays may potentially cause cancer in biological tissues. This is due to the nature of X-rays, as they cause ionization of micromolecules within our body. In addition, tissues are affected indirectly by the ionization. This is because X-rays prompt the radiolysis of water, which leads to the production of reactive oxygen species, that in turn damage tissues by several mechanisms, such as disrupting calcium homeostasis, inducing cell death, and bone abnormality. However, a study conducted by Hu and his colleagues on the relationship between X-ray radiation and biological tissues suggests that limiting the radiation dose and usage of X-rays is essential to decrease the risk of getting cancerous cells. The ionization ability of X-rays may have other impacts, such as the unfavorable use of X-rays for pregnant women and small children, as the radiation can cause harm and mutation of the infant. Also, high doses of radiation cause reduction in the sperm production, which can lead to increased chance of infertility. In addition, some people may encounter temporary allergic reaction or kidney problems when using iodine-based contrast media. Despite these disadvantages, it's not practical to completely eradicate the use of X-rays, as the disadvantages are low in comparison to the advantages, and can be improved by using more sensitive detectors, which enable the obtaining of images in short period of time, hence lowering the time of radiation exposure, and increasing awareness of radiologists regarding the effect dosage required for the patient.
When talking about the successful methods in the markets, recent study conducted by Radian on the comparison of the conventional X-rays and CT suggested that X-rays have not been very successful in viewing small soft parts of biological tissues, whereas the use of CT proved to be detecting types of bone lesions. Overall, these methods both use contrast agents to view soft tissues. New studies on phase contrast X-ray imaging alludes to significant improvement over conventional attenuation-based X-ray imaging without the need to use contrast agents. Phase contrast is a technique of creating changes in the phase of an X-ray beam. In creating these changes, the beam is transformed into variations of intensity as it is traversing through the sample, which are then recorded by a detector. When applied to samples with low atomic numbers, such as soft tissues, phase contrast X-ray imaging is more sensitive to density variation in the sample than conventional X-ray imaging. Therefore, this technique leads to images with improved soft tissue contrast. Moreover, research into phase contrast imaging suggests how this technique allows for a reduction in the radiation dose delivered to the patient. Another future promising prospect is the development of new X-ray detectors which could address improvements with respect to performance and lower radiation dosages. Photon counting X-ray detectors have gained increasing attention in recent years. Unlike the current flight detectors, which measure the overall charge created by all absorbed X-rays during a given time interval, photon counting detectors enumerate each individual X-ray photon whose energy is above a predefined threshold. These detectors reduce the radiation dosage given to the patient while providing enhanced image quality by improving spatial resolution and reducing detector noise. The general structure of the photon counting detector is shown in Figure 3.
In conclusion, X-rays are an essential part of the world, and in particular the medical imaging field. X-rays and their different variants help to show internal structures of various parts of tissues and contribute to treatment and diagnosis of many clinical cases. The current research into reducing radiation dose in medical phase contrast X-ray and the development of photon counting detector are currently providing promising prospects that are highly attracting the attention of many scientists to improve X-rays with the aim of achieving maximum impact on patients with a minimum cost. Finally, future implications of X-rays may offer us a great system performance with images in true colors and greater details than the conventional X-ray techniques. These are the references that we used throughout the presentation.